Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your first week of March 2021. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Wednesday, March the 3rd, 2021. I'm going to share with you 6 areas of health and wellness. Somewhere around this video you can read through all 6 of those areas, and it's a good one today, chock full of some good information for you. And if you'd like a copy, just DM us on social, call us at the clinic, send us an email, we'll be sure to get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease today together with us right now, but we just might stimulate some good action-taking, behavior modification, some choices that you can make throughout the day to support your own health and wellness, and maybe even the health and wellness of those around you. That's our goal for today. According to the Childhood Obesity Report, February 2021, there are certain risk factors that predispose to childhood obesity. At 2 years of age, excessive screen time, sleeping less than 12 hours a day, and frequent fast food soft drink consumption are risk factors for obesity by age 4.5 years. So those are 3 things that we want to definitely enjoy in moderation or try to achieve within healthy parameters. The screen time, our hours of sleep, and consuming those high calorie, low nutrient dense foods as much as possible. Speaking of nutrients, in the journal Nutrients, their report January 2021, they talk about health problems linked to magnesium deficiency. For a long time, it's been known that North Americans typically run low on magnesium, and individuals who fail to consume the recommended daily intake, which is about 300 to 400 milligrams per day, they have an elevated risk for cardiovascular disease, metabolic syndrome, type 2 diabetes, respiratory conditions, dementia, widespread muscle pain, bone fragility, and some cancers. Foods that are rich in magnesium include things like avocados, trending lately, right? Lots of avocados, dark chocolate, everyone's good reason or excuse to get some chocolate into their life. Different nuts, legumes, tofu, seeds, whole grains, fatty fish, bananas, and leafy green vegetables. So again, lots of things to choose from. You don't have to eat all of those every day, but getting a variety of foods throughout your week probably expose you to different kinds of nutrients and ensure you're getting those magnesium requirements that you need to be healthy. So that's a good little tidbit for you there. Journal of Physical Activity and Health, February 2021. Now that you're eating well and want to be engaged, they found that having children can influence your physical activity. In a study that included nearly 1,000 adults, researchers observed that both men and women reduced the number of steps they take per day following the birth of a child, suggesting a reduction in overall physical fitness. However, the research team notes that as the participants' children age, their average steps per day increased. So I could see you having to keep up with those little ones as they start moving more as they grow up, and you want to stay engaged with them and participate in some things with them for sure, as well as taking them here and there. Might get you busier, but when they're first born, you want to ensure that your activity doesn't decrease until theirs starts to increase. So at all stages of life, we want to make sure we stay active and in motion. And in teenage years, they might need a little bit of encouragement, not just for their nutrition and their physical fitness or activity levels, but also to help with their mental health and wellness. Clinical Nursing report from Spain in February 2021 looked at new research that suggests an overweight or obese adolescent is more likely to stick to a healthier diet or exercise if they have the support and encouragement of their friends and family. Of course, if someone is happy with the way they are and it's not a concern and everything is going well, then no need to mention it perhaps. But if someone comes looking for help, asking for help, or it seems like they may be in need or want or desire of help in any healthy way for some change, then it's good to be there for them. Be a good friend or family member as best we can, and we can support each other on this health and wellness journey that we're on called life, right? The Consumer Product Safety Commission, January 2021, comes out with an interesting tip, maybe for all of us, but especially if we have children, to reduce furniture-related accidents. The United States Consumer Product Safety Commission notes that roughly 5,550 Americans visit the emergency room each year due to incidents involving tipped-over furniture. To reduce the risk of furniture-related accidents, the Commission recommends the following: anchor your TVs, bookcases, and dressers securely to the wall. Always place TVs on a sturdy, low base. and push the TV back as far as possible. Avoid displaying or storing items where kids might be tempted to climb up to get them. Store heavier items on the lower shelves or in lower drawers. If you move the older TV to another room, be sure it's anchored to the wall properly as well, and keep the TV and cable cords out of kids' or children's reach. Some good safety tips there. It doesn't seem like an issue, and sometimes we wouldn't even notice or think that those are safety issues, but obviously there have been some incidents, so these are some good things to take into consideration. Finally, from the Chiropractic and Manual Therapies Journal, January 2021, this is a common question we get in the clinic is, of course, how chiropractic works. And quite often, you can go online and see how anything works. There are anti-inflammatory things you can do or take in your life. Some of them are natural, some of them are over-the-counter, some of them are prescribed. And they all have a method by which they work. And spinal manipulation is no different. So following 6 spinal manipulative therapy treatments spread over 2 weeks, researchers observed that patients with either acute or chronic back pain experienced a reduction in several inflammatory mediators such as interleukin-2, interleukin-6, and IFN gamma, it looks like, maybe, if I'm correct on that one. The finding adds to a growing body of research on the benefits associated with spinal manipulation, the primary form of treatment provided by doctors of chiropractic. And quite often in the clinic, we show people that if they're taking aspirin, there's a way that aspirin works. It interacts with certain chemicals and receptors in our body to make the change that it does to help with inflammation. And there can also be some benefit from an adjustment and how it influences the nervous system and the tissues to also help with inflammation, but also some other beneficial side effects that chiropractic does. So everything has its course of action and how it works with your body to create those changes. And the chiropractic adjustment is no different. And it's not just always a physical thing, but it can be a neurological thing and also a chemical thing. And it all works in your favor. No drugs, no surgery, which is kind of cool. All right. So that's your daily health update for today, for Wednesday, well into the week, this first week of March. Hope you're enjoying it. We'll be back tomorrow, Thursday, with your daily health update. We'll look forward to seeing you then. Until then, keep smiling, do well, and all the best.